So let me take a little grenade here and pull the pin and put it on the table. Now that we've got oral medications, are there other specialists, for example, primary care physicians, who should be able to treat MS? Who wants to dive in on that, Andrew?
Yeah, so I think as we've been discussing for the last hour or so, the treatment and management of MS has become increasingly complex over recent years, given the menu of choices that we've discussed. And I actually think it's at least the choice of therapy and the monitoring of therapy really, in my view, requires considerable expertise in MS, likely beyond the scope of practice for people in either general practice, for that matter, even in the general practice of neurology, unless they have a substantial experience with MS.
So you want to back it up not just away from primary care, but away from necessarily general neurology.
I mean, that's my view. We're dealing with again, complex disease, complex choices, and some potentially very serious complications of the therapies that we choose. And it really requires, in essence, constant monitoring.
No, go ahead, I'm sorry.
I just think the reality is that even here in the United States, there are areas where there are not neurologists. And believe it or not, the primary care of MS is by a primary care physician. And I think in that sort of setting, and maybe telemedicine is a very good thing to use, you want tie-ins to MS centers. You want tie-ins, and you can co-manage. The primary care physician can co-manage with neurology experts. Now, that's a small cohort. With regard to the MS centers and MS experts, I agree that the ideal situation would be to have every MS patient followed. It's impractical, can't be done. But you can align, and you can have a difficult MS patient seen in an MS center, decisions made about therapy, go back to their practicing neurologist, keep in touch by phone or by email, see them once a year, that sort of thing. And that's how I think we have to globally think about it.
We all do variations of exactly what you've described.
But you're all involved as specialists at the same time. Let me just ask a mechanical question. How many areas, and you may not know the answer to this, how many areas in which there are no neurologists also have adequate gadolinium MRI facilities? So you'd have to go to the machine anyway. Right? I mean,
we have a lot of MRIs everywhere. The question is, are they doing an adequate protocol and standardizing, et cetera? And exactly.
And who's reading it? Well, that you can do by telemedicine.
That's true.
But since we talked